anterior regions of the body. We will use this diagram as a guide as we go through the video. Some of these terms are things you're probably fairly familiar with, whereas others are certainly going to be new as we go through and talk about these different regions. The first one to talk about is the nasal region. So it's kind of like work our way down through the terms on the left. So the nasal region refers to the nose. So this is one that you're probably a little bit more familiar with. The oral region is another one that most likely you've heard of before. So the oral region is the mouth. So you think of like an oral surgeon, right? Someone who would remove like your wisdom teeth, right? Someone who's doing mouth surgery. The next one moving down is cervical. This one is probably a little bit different from things that you're aware of, but the 7 vertebral sections in the neck are part of the cervical spine. So your backbone has different regions to it. The cervical region is the topmost region. So it's really like the parts of your backbone that extend up into your neck, up to the base of the head. The next one is the thoracic. So now we're talking about the 12 vertebral sections in the mid-back. So these are numbered from T1 through T12. So this is part of what gives us like that curvature of the upper back. So it points to these really like on the front. I think it's one of the few things on this diagram that can be a little confusing. If we're talking about the vertebral sections of the back, that's definitely more of a posterior one. But the thoracic cavity is the chest cavity. So we'll talk about like different body cavities and regions. So like that's where you have like the heart and the lungs inside of there. So again, like a lot of these terms you may have heard of referred to different ways, but that's one way. You potentially may have heard of that one. The brachial region is the upper arm. So the biceps brachii, right, is the name for the biceps muscle. So if that's one that you're familiar with, right, the brachial is the upper arm region there. The abdominals are between the thorax, which is the chest, and then the pelvis. So the abdominal region, I will talk about quite a few of the organs and things that are in there. There's also different sections to this region. There's actually 6 different subsections of the abdominal region. So we'll get into that more when we're talking about body cavities as we work our way through this unit a bit further. But then the last one for the first section here is the umbilical region. So the region of the abdomen there underneath of your belly button, right? So your umbilicus is your belly button. But the umbilical region is just sort of like the lower part of the abdominal region. So that is actually one of the abdominal sections that we'll talk about. And then carpal is one that you may be familiar with already, but carpal referring to the wrist. So if you know someone who gets like carpal tunnel as a circulatory issue in the wrist, has to wear that wrist brace to kind of help with that. That's one that you may be aware of from some previous experiences. The next one is the pubic region, so the lower part of the abdomen, right above the external genital organs. So we have the male diagram here, but the pubic region is the region where you would find the different genital organs, whether it's male or female. The patellar is the kneecap, so like the outside portion of the knee there. Again, one that you're probably aware of, like the patella tendon, is one that you're most likely familiar with. This is one where maybe the pronunciation, easy for me to say, right? It can be a bit of a struggle here, but this is pronounced curl. So I almost think of it as just being spelled like C-U-R-L, like curl. So this is the curl region is the shin area of the leg. So that sort of front part of the lower leg region. The next one is the tarsal region, which is the ankle. So I think of like the metatarsals are like the main bones in the foot. So the tarsal is just above that. Speaking of the foot, so pedal region is the foot in general. So we'll talk about like some of the individual parts of these. So a lot of these are kind of like general regional terms, and we'll go through and talk about some specifics to some of these later on. But then fibular is the outside part of the lower leg. So something you may be aware of is that there's 2 main bones in the lower leg, right? The tibia and the fibula. So the fibula is the outside bone. So that is the outside part of the lower leg there. Speaking of lower leg bones, the femoral region is the upper leg or the thigh. So the femur is the main bone of the upper leg there. And then the last one on our list here is inguinal. So this is the lower lateral part of the abdomen. So if we're looking here, like the inguinal part is basically like the groin region, where like the lower part of the pelvis like meets with the upper portion of the thigh. I'll just go through the last few of these. The manus region is the hand. So in your typical like anatomical position, the hands are upturned with the palms facing forward. So it makes it a little bit easier to talk through this. I will talk about some different regions of the hand. But then the pelvic region is the lower part of the trunk that connects the abdomen to the thighs. So you think about like the pelvic bone, that sort of bowl-shaped pelvic bone in your skeletal structure. It's the thing that's connecting the upper and lower body regions together. So the mammary region is the chest or the breast region. So depending if we're talking about like male or female specimen with this. But the mammary region, just specifically the outside part of the chest. The axillary is sort of like the outer chest extending into the underarm. And then the next one is the sternal region. So like your sternum is at the mid part of like your breastbone there. So the sternal or sternum. And then final one to talk about on our list here for the anterior body regions is orbital. And orbital is referring to the eye. So as I mentioned to you before, some of these are kind of general terms that we'll talk about more details with later on. Others are things that are a little bit more specific. So like for example, like carpal, we're not going to get much more detailed than that for the wrist, but the abdominal region is broken down into some subregions that we'll talk about as we work our way through this unit. So hopefully many of these are terms that are already somewhat familiar to you based on some of your previous experiences. But what we'll talk about this chapter is just practicing with them. It's good to know this diagram. You'll see this one in some of the classwork assignments to go through and label some of the images. So hopefully you're taking your time with the notes going through this video. Once you're finished with that, please answer the questions at the end. That'll allow you to practice a little bit with this vocabulary. Thank you for watching.